Can you hear me?
I can hear you loud and clear, and I want to introduce everybody that's going to be trickling in to our, what will hopefully be incredibly productive and interesting and educational discussion this afternoon. I'm John McGarvey, one of the co-founders of DAO Labs, and I'm with my esteemed colleague and fellow co-founder, Eric Karchmer. And then I'll talk about some of the other participants here in a second. I'm here in Minneapolis, Minnesota. Eric is hunkering down in the hills of North Carolina with us this afternoon. And today's topic is actually a very exciting one. We're going to be talking about our women's kit and the two powerful formulas that comprise it. It's the emotional balance, which has been a customer favorite of ours, and then the women's formula that are combined two very, very powerful Chinese formulas. The purpose and the mission of DAO Labs is to make Chinese medicine very accessible to anybody. And we do that in a lot of different ways. We do it through formatting, we do it through branding, we do it through hopefully flavors, and we do it through initiatives such as this. And if you look on our website, you'll see that we have a handful of values out there, one of which is it's a shared experience. And the more we can make Chinese medicine accessible and understandable to anybody, the better we can do our jobs. Just to give a little bit of background on Eric, I've known Eric Karchmer for about 6 years now. He and I have traveled, I would say, multiple times to Asia. I've been in hospitals in Beijing with him, where he's actually talking with doctors, and he's in some cases consulting over patients and whatnot. And it's pretty incredible. Eric's practicing acupuncturist in Boone, North Carolina. His training comes from the Beijing University of Chinese Medicine, where he studied for over 5 years. It's pretty impressive when you think about that, and also the fact that he did it all in Chinese, which is pretty cool. And then he turned around and got a PhD on top of that. So he's a pretty well-educated guy, but the wonderful thing about Eric is he breaks it down for us in a way that's pretty digestible and easy to understand, and that's what we're going to hopefully do today as we talk about the women's kit. From an administrative standpoint, we want you to ask questions. This is a free-form, flowing conversation. I think there's some buttons at the top of your screen that you can ask questions. You can join the conversation. My colleague Tracy Dwight is sitting here and will help field a lot of those, and we'll get to as many as we can. And those that we're unable to, we promise to follow up either directly over email, or we envision putting a blog post together that kind of comprehensively brings everything together. On top of all that, we are going to be talking about a product and some formulas that we offer, and as a sort of a thank you and a way of helping you kind of lean into these formulas, we're offering a discount code for today's participants. It's CYCLE10, CYCLE 10. And once we get through the discussion today, hopefully you'll be enticed to at least take a look at these things and use that code. You'll save 10%, and everyone likes a deal. So visit mydaolabs.com to save. And then again, we want you to ask as many questions as you want. So the format will be Eric will go through about 10 slides that are pretty interesting, talking about how women in the East approach their cycle relative to how women in the West approach theirs. And we'll try to break down terms such as qi and deficiency and heating and things like that. And then we'll open it up to questions. So with that, I'm going to continue to moderate here the best I can, but I'm going to turn it over to Eric. And without further ado, he's going to kind of walk us through this pretty incredible topic.
Well, welcome, folks. It's my pleasure to be talking with you, and I'm looking forward to your questions. I've kind of prepared, as my colleague John mentioned, about a dozen slides or so about just some basics about managing a menstrual cycle from the perspective of Chinese medicine. And I wanted to begin with sort of also some just insights. I am also an anthropologist, and I do research in Chinese medicine, and just some sort of ethnographic insights about just women in China and how they think about their period. And let's see if we can go to our first slide. I think one thing that's really different in China is that women think about their periods to as far as I can tell, as an observer, in a very different way than women in the U.S. do. I think women in the U.S. tend to think of them a little bit more as a hassle, something that interrupts or interferes with an active lifestyle. Whereas in China, they're a little bit more of a, not that it's necessarily pleasant for every woman, but they're more of a natural part of life. And if you can go to the next slide, women in China believe very strongly that you can manage your menstrual cycle through diet and through lifestyle. So what you eat is extremely important, especially as sort of your period approaches. And we won't spend too much time on this topic, but if you've spent a little time in China, you'll know that women, for example, will be very cautious around foods that are considered cold. Cold often meaning foods that are both physically cold, but also hard to digest. And if you're not careful, the consequences can be something really unpleasant, a really painful period or something else. The reason women think about this, though, think about their menstrual cycles differently, I think has a lot to do with just sort of the historic influence of Chinese medicine over generations. And what's different about the Chinese medicine approach to menstrual cycles versus sort of the biomedical approach to the menstrual cycle really comes down to, like, I would say, one word. And if we could go to the next slide, and in Chinese that word is called tiao. And that word means to harmonize, to adjust, to modulate, to regulate. And this word is the key to practicing Chinese medicine gynecology. It's the key to women sort of managing their menstrual cycles as best they can on their own. It's also the key to fertility. For those of you who are struggling to get pregnant out there, or for those of you who are practitioners and have patients that are in that situation, this concept of harmonize is your key idea. You want to harmonize the menstrual cycle. Well, we'll talk a little bit about how you do that, and the two formulas we want to talk about today, we call them women's formula and emotional balance, are really foundational formulas for doing precisely this. But before we do, I think let's just do a little bit of a review of biomedicine here. I think this can help us as we get into the Chinese medicine perspective. And I want us to kind of just look at this diagram on the left here of our screen. And you'll see that at the very bottom, we're going to work our way up from the bottom. So at the bottom, there's sort of essentially what's a cross-section of the uterine lining. And what we see is at sort of day zero, we see that sort of crumbling and sloughing off. That's the beginning of a woman's period. That happens for a set number of days, 3, 4, 5. Depending on the person. And then from there, we see the uterine lining slowly rebuilding until the end of the cycle, where it begins to slough off again. Moving up to the next level, we see the ovarian hormones. And we don't need to get into too much detail here, but I think the significant thing here is that what we see is right in the middle, where that dotted line comes down at day 14, we see a rise in progesterone. That happens after ovulation. That progesterone is produced by the ovaries primarily, and it will drop off again at the end of your cycle, which is in a sort of textbook scenario, maybe 28 days, but for some women shorter, some women longer. And it'll drop off as, and that fall in progesterone is what leads to the beginning of the period. Moving up one more level here, we see right in the middle of the cycle, we see a little spikes, green and blue spikes. That's luteinizing hormone and follicle stimulating hormone. These are the hormones that are responsible for ovulation. So they happen right around sort of day 14 in that textbook cycle, and it might be a little earlier or a little later, depending on how long or short your cycle is. But there's a little spike right there. And coinciding with that, in the next segment of the picture, we see a chart of body temperature, and what we'll see is that once ovulation happens, there's a little spike in basal body temperature. Some women who have been working on getting pregnant may actually chart that as a way to follow whether ovulation is happening. That spike usually happens about 24 hours after ovulation. And at the very top of the diagram here, we see sort of a diagram of the follicle. The follicle is what releases the egg. We see it maturing in the first half of the cycle with that LH, FSH spike, and right in the middle, we see the release of the egg. And then the follicle itself turns into what's called the corpus luteum, and that's what produces the progesterone. And if you were to get pregnant, that would be what maintains the pregnancy until sort of further developments happen with placenta, and then that would sort of take over that function. So what's significant for us here, this is familiar to practitioners and probably not too familiar to our average consumers, but I want you to just to notice two things. First, we have two sort of transitions here. One, right at day 14, we have that spike of LH and FSH hormones. We have the sudden rise of progesterone. So we have a little hormonal spike there in the middle, and then we have this big drop-off of progesterone at the end of the cycle. And those are two shifts that happen. And women don't usually have much experience of ovulation. There may be some sensations around that. Women more commonly will know, it's more common to have, PMS, premenstrual symptoms for some women at the end. But we want to notice that there's two shifts there, and one of our products, Emotional Balance, is going to help us to kind of work through those shifts. The other thing to notice too is that right after menses is completed, your period is over, we start to see the slow rebuilding of the lining of the uterus. And that's also right around the time when we're going to want to use our other product, Women's Formula, to help get that process sort of off to a good start and set you up for maximizing your chances at fertility, and for also improving sort of reducing symptoms with your period if that does come later. So now let's turn to the Chinese medicine perspective. We'll see it's not nearly as fine-grained. And can we go to the next slide, please? And today we're just now there's a lot to think about here, but we're going to just focus on two key terms. And the first one is blood. Blood is in Chinese medicine is known as the foundation of woman. It is the most important thing to think about when you're doing Chinese medicine gynecology. Now, we need to point out that blood in Chinese medicine is not the same as blood as we understand it in Western medicine or biomedicine. It doesn't contain platelets and red blood cells and white blood cells. It does some different things, but it's similar, and it is sort of at the most obvious level the thing that we see related to a woman's menstrual cycle. Now, when we want to think about blood in Chinese medicine, the other thing that goes with it is qi. So blood and qi are kind of a yin-yang pair, if you will. And there's a famous expression in Chinese medicine, and I'm sorry, there's a little mistake here. It should say that qi is the commander of blood, and blood is the mother of qi. And what this means here is that qi is what moves blood. Blood is sort of what contains or holds qi, and so that they mutually support each other, and you sort of can't think about one without the other. Now we're going to look at a famous quote from a late imperial physician, Chen Shouyuan. He was writing in the Qing dynasty. This is the last dynasty in China, and he has a well-known book called Essentials of Women's Medicine. And I think this little passage here really captures kind of the importance of blood, particularly in Chinese medicine. And we'll see in this passage that he uses the word yin and blood together. So I just want to, before we read the passage, I just want to say that yin is sort of a more encompassing way of thinking about sort of the fluids of the body. And so yin would sort of include blood, but here he's sort of talking about both. But in short, he's, again, it's referring to the importance of blood in this passage. So we've translated part of the passage, and it says, when blood is flourishing, the menses is naturally regulated and pregnancy is easily achieved. When yin and blood are ample, no disease can arise. When yin and blood are deficient, numerous illnesses will occur. Moreover, a woman's blood is consumed during menstruation and exhausted by childbirth. With the diseases of leukorrhea, which is vaginal discharge, and uterine bleeding. This is abnormal uterine bleeding. There is great loss, or in fact, it'd be better to translate even greater loss. Therefore, treatment for women should focus on yin and blood. So I want to point us to kind of two parts of this passage here. We want to note that first, blood is very important for women, but that, and when your blood is ample, you are healthy, and when it's not, bad things will happen. But what's even more important is physiologically, women are going to lose a little bit of blood during every month. Now, it's not necessarily a tremendous amount. The average woman might lose 30 to 40 milliliters. A heavy period might be as much as 60 to maybe 80 or more milliliters. But again, it happens month after month. Many women with heavy periods will actually become anemic. And again, blood isn't quite the same thing in Chinese medicine as it is in Western medicine, but nonetheless, there's this idea in Chinese medicine that there is some sort of loss that's happening every month. That is then complicated by childbirth, which is an even more sort of depleting event. And for those of you women who've gone through childbirth, you have experienced that firsthand. Now, moreover, beyond the physiological part, this last two sentences remind us that then if we have certain illnesses or diseases, other gynecological problems, they then kind of contribute to even greater loss. So treating yin and blood, or in particular blood, is sort of the key to treating gynecological problems in Chinese medicine. Now, to explain this a little bit further, we want to go just a little bit deeper into Chinese medicine diagnosis. And there's a lot we could talk about here, but we're just going to kind of boil it down to two key concepts, which I think will help us understand our formulas. They kind of line up with each with one of these concepts. And so the first one is this concept of excess. When you're sick due to an excess, there's some sort of external pathogen or potentially some sort of internal accumulation. Now, we talk about external pathogen. In Chinese medicine, we're talking about things like wind, heat, cold, dampness. Now, those are familiar terms to the practitioners and not so familiar to the consumers out there. But at the beginning of the talk, we mentioned, for example, the idea of cold, literally eating cold food or exposing yourself to cold, rainy, damp weather or something like that. That can lead to issues. That's a little bit different way of thinking about the causes of illness, but that's a very important one in Chinese medicine. Now, it's a little bit more important for us today is sort of those internal what I call accumulations. And those would be things like qi constraint, blood stagnation. We'll talk a little bit about those two. Other things like phlegm and dampness. So we don't have time to get into all of those, but excess is something we need to think about for sure during when treating gynecological problems. And then the other thing we need to think about is the opposite of excess, which is deficiency. Now, deficiency is a concept we almost can't think about in Western medicine. If excess, now, and let me add a little point of clarification, if pathogens, conditions of excess are usually something that are a little bit more acute, that come on suddenly. Conditions of deficiency are things that come on more slowly. So they're not caused directly by any external pathogen, although external pathogen could make one worse. And they're generally defined by some sort of lack of essential substances. And that might be a lack of qi, blood, yin, yang. We can also talk about organ deficiencies, and we won't go too deep into that in this webinar just for lack of time, because that's complicated. But a deficiency is something that's usually going to come on slowly. So if we think back to the previous passage from Chen Xiaoyan, we talked about menstruation causing a little bit of loss every month, childbirth causing a little bit more, sort of a couple of diseases, or whether they're gynecological or perhaps something else, they can all contribute over time to, some sort of deficiency. And so if you're a 19-year-old or a 20-year-old woman, you're less likely to have those things. But by the time we get into our late 20s and 30s and 40s, a lot of us are dealing with, various kinds of deficiencies. These are two different ways of thinking. They're very broad stroke, but also extremely useful. They're two different fundamental ways of thinking about how things go wrong in the body in Chinese medicine, and they're very important for gynecology. And they take us next to our formulas. And so our first formula, women's formula, which is based on the classic formula called Su Tang, which is kind of a formula that's roughly 1,000 years old, but is based on another formula that really goes back to almost 2,000 years, is a classic formula for treating blood deficiency primarily, but it also does treat a little bit of blood stagnation. And this is sort of how formulas get balanced in Chinese medicine. You don't want to supplement blood too much. That could lead to problems. So you also want to move blood a little bit as you do that. And the sorts of problems you might see with this would be irregular blood flow. Now, this can be both sort of a lack of blood flow, something scanty or an absence of a period, or it could be excessive. We often talk about how blood stagnation itself can lead to increased blood flow. You'll often see abdominal pain with this, dizziness, maybe insomnia and heart palpitations, a pale complexion. So Su Tang would treat all these symptoms, but it's almost a little bit, this list is almost a little bit misleading because the reality of the matter is that in clinical practice, women's formula is sort of the foundation for kind of just about everything that Chinese medicine doctors will do. They will take this formula and then modify it in various ways to achieve the effects they want to. And so this is sort of this one formula itself is almost the foundation of Chinese medicine gynecology. Now let's look at the next formula. We call this emotional balance. It's based on the formula Xia Yao San, and it's also one of the most popular formulas out there in Chinese medicine. This treats a little bit more of the problem of excess. Now, what's interesting about this formula is it also deals with some deficiency here too. But let's focus on the excess for a second, and that excess is qi constraint. In particular, it's a liver qi constraint. Now, this is also complicated by a little bit of spleen qi deficiency and a little bit of liver blood deficiency. So this is what makes this formula particularly interesting. But if you remember, qi constraint is a way of talking about poor flow of qi in the body. And if you think about it, when qi is flowing, kind of everything is flowing and operating as it should be. And this is that formula that is going to be really useful for us during those moments of transition in the cycle, both ovulation and that period leading up to the period leading up to the menses itself. So some of the symptoms associated with it, we can break them down a little bit in terms of the underlying pathology, but qi constraint, which goes together with a little bit of blood deficiency, will result in emotional volatility, pain in the flanks, breast tenderness, headaches, dizziness, perhaps dry mouth and a dry throat, irregular menstruation. Many women may recognize those symptoms as very common during sort of PMS. But the spleen qi deficiency will also lead to fatigue, perhaps a depressed appetite. You might even be sort of alternately hot and cold. So these two formulas, the first one, women's formula treating blood, the second formula, emotional balance, treating qi, are two really key formulas for thinking about for managing a woman's cycle. So let's just go to the next slide and look at a couple popular ways that these formulas are used in China. So women's formula is among the most popular. As I said, it's the foundation of gynecological clinical gynecology in Chinese medicine. But it is used very commonly by women who just want to manage their cycle. So if sort of diet and lifestyle aren't quite enough, many women will turn to this formula perhaps on their own. And a common way to do it is to 1 or 2 days after the end of the period, you'll take Su Tang or women's formula for 5 to 6 days. And this both helps you recover from the previous period, right? You have that little bit of blood loss, but it also kind of helps your body prepare for the new cycle. It kind of gets you off to a good start. And then down the line, when the next period comes, you should have less discomforts during menstruation itself, less bleeding irregularities. Emotional balance, one very common way to use this would be to manage something like PMS symptoms. So typically, if you know when your period comes, you might start a week, perhaps more, depending on how long the PMS symptoms last. And you can start with emotional balance and do it right up until your period comes. And that's a great way to manage all those unpleasant symptoms that come with PMS. And they're really about this problem of chi constraint, and this can kind of, and we notice also too it's a period of high emotional volatility. So this is a formula that can really help you get through that period. Now, at DAO Labs, we also have what's called a women's kit, where we put these two together, and this is, I think, really useful. Not only because you might both want kind of the help of woman's formula to kind of get your period off to the right start, and the help of emotional balance to get you through PMS. But there's some other uses of the formula that we want to let you know about. So let's move on to the next slide. So one really interesting use here is for fertility. And if you think about it, at the beginning of this talk, we said, regulating this menstrual cycle, that is the absolute key to sort of just having the most sort of symptom-free menstrual cycle, but it's also the key to getting pregnant. And the more the cycle is, and this is unlike Western medicine. In Western medicine, the approach to infertility is, it's of course successful and many times, but other times it's not. It's essentially sort of to take over, to hijack those that whole hormonal feedback loop to make a woman ovulate on a particular day. If we're going to go for IVF, you're going to want to do even more hormones to help harvest eggs and do an in vitro fertilization. But it's really sort of this taking over of that whole hormonal feedback loop. Whereas in Chinese medicine, we're trying to optimize it as best we can. Now, so one way to do that is then to use these two formulas a little bit differently. Use women's formula as you would normally, right at the beginning of the cycle. And then, now depending on how short or long your cycle is, you want to pretty quickly after that kind of follow with emotional balance for about 5 to 6 days. And you want to kind of time it when you think ovulation might be happening. And we can talk a little bit in the question and answer session about how to figure out when ovulation is happening. And if you do that, you might really facilitate ovulation. And the more that kind of happens on a regular basis, the better your chances are for getting pregnant. Now, another possible use here too is also for lactation difficulties. Qi constraint is a big problem for some women. We often think of we mentioned that it's qi constraint is really happening in the liver in Chinese medicine. We think of the liver as being associated with the breasts and milk production, and so dredging, soothing, moving liver, moving qi in the liver is one way to help facilitate and promote milk production. And at the same time, we also mentioned that after childbirth, a woman is considered almost by definition in Chinese medicine to be blood deficient. So if you use women's formula, now one way to try this might be women's formula in the morning, emotional balance in the evening. This could be a really useful way. Now, it's not guaranteed for every woman, but for a large number of women that are struggling with lactation, this could be a really useful way to kind of improve it. So there's a number of uses, and we can talk about a few more. A couple questions that have come from our consumers have been, you can see here on the screen. So question one: how do I take women's kit if I struggle with irregular periods? I would suggest doing kind of precisely that program I just mentioned for fertility. Women's formula at the beginning of your cycle, followed by emotional balance, sort of right at that, leading right up to ovulation. Ovulation also is sort of a key moment in sort of the timing of the period. Once ovulation happens, basically there's sort of your period's coming in about 12 to 14 days, and in most instances, that's sort of locked in kind of physiologically. So if you're having periods that are, 35 days 1 month and 26 the next, and then back up to 33, that means you're probably not ovulating they're probably not ovulating at the same time in your cycle, and so emotional balance could be a really useful product there for helping to make that happen right when it should. Another question that we got from some consumers was, what do I want to do if how could I use the woman kit if I haven't had a period since having a baby? So those of you who have had children will know nursing a baby causes another interesting sort of cascade of hormones, which actually prevents a woman from menstruating again. There's very good reasons for that. You probably don't want to have another baby right after you've had one. Nursing a baby will prevent you from getting pregnant. Typically, a lot of parents will start giving baby a little bit of solid food at 6 months, 8 months, something like that. As your baby gets onto more solid food and becomes a little bit less dependent on the mother's milk, that hormonal cascade that's happening starts to shift a little bit, and usually around a year or so, many women will get their period back. It doesn't always happen. Now there can be some complicated reasons for that, but probably it will happen. And one way, one way to really promote this, if you decided you're pretty much, done with nursing. I mean, one important way is to cut back on nursing. This will definitely promote that hormonal shift. But if that's still not working, then the women's kit, which, as we mentioned, can be so helpful for ovulation, can be really useful here. So I think another good use of it would be, again, like that lactation sort of little regimen. Try the women's formula in the morning, and emotional balance in the evening, and just kind of keep doing that for a week or 2 weeks, and kind of maybe even longer, and see what happens. That might be enough to kind of make that shift happen. Third question is, how do I take women's kit if I just went off hormonal birth control? I think you can use it sort of in that same way. Women's form in the morning, emotional balance in the evening. You could flip that if you want. That doesn't matter so much. Women should recognize that getting off birth control can be more challenging for some women than others. Birth control pills work by interrupting that hormonal feedback loop that we looked at in one of our earlier slides. Birth control pills are essentially a combination of estrogen and progesterone. And so because they're exogenous, they're coming from outside the body, particularly ovaries' ability to produce some of those hormones gets interrupted. And so for some women, it's just not that easy to get the period started, and they may go a year or more. I think the women's kit is one good way to kind of, you're going to need to give it a little bit of time. But if you feel like you've waited long enough, the women's kit is one way that might really help you to get that started. You may need to do something more complicated, and that's when you go to see your local practitioner. But this is definitely a good option. Are there any side effects to taking the women's kit that I should be aware of? There can be. Probably in most situations, I think most women are going to do pretty well with it. These are two very nicely balanced formulas. They're generally well tolerated. What you want to do is you always want to sort of just be observant. And if you notice that while you're taking a particular formula, you feel a little bit worse for a particular reason, then you just want to stop. And if you see the symptoms going away, then you know, oh, that wasn't a good fit for me. And last question, will I see an improvement right away? How long does it take? That depends. So if we're talking about something like PMS, you may see some improvements with emotional balance right off the bat. That might be within a day or two. You might really feel some genuine improvement. However, if there's sort of a more long-term underlying deficiency to that, those improvements may take a little bit longer. It might take you a few cycles to kind of work that through. One challenge in gynecology in general in Chinese medicine is that a lot of women don't have. They may not have a tremendous number of symptoms, and you sort of have to wait for the period to come along to see how they've responded to your treatment. So sometimes you do have to just follow things over a period of months to really see how it's going. So when we recommend that women who are taking women's formula try it over a period of a couple of months. Again, we're just recommending that you take it for 5 or 6 days at the beginning of the cycle. But to do it once, you might see some changes with that next period, but you probably want to do it a couple more times and just kind of track it over a period of a couple of months to really see those changes. So you kind of just have to keep that perspective in mind with these products as you're using them. So hopefully that gives you a basic introduction to these two products. Are there any questions out there?
Actually, Eric, we do have a handful of questions that have already come in, and I invite everybody to continue asking questions using the buttons at the top of your screen. Just a couple of things, if you want more information about any of the discussion points that Eric has just gone through, from the product to the sourcing to where do we get all this stuff, please visit mydaolabs.com. That's MYDAOLABS.com. And again, the discount code, not to be too salesy, but we do want you to try this, will be cycle 10. And to be specific, it's a 10% discount on the 2-month trial, which when you get to the women's kit page on mydaolabs.com, it's going to be the middle option. We do have a 100% satisfaction guarantee, or happiness guarantee, I think we call it. And we do want you to be happy. And Eric's right. It's going to work, we think, for the majority of women who it's a fit for. But if this is something that you try and it just doesn't work, or you're not satisfied, we want to know about that. We want to make it right. So do keep that in mind. A couple of other things that I do want to point out before we open it up here to some of the questions are from a sourcing and from a sustainability standpoint, we take both of those topics extremely seriously. Everything from a sourcing standpoint does originate in Asia, but we test every step of the way. And we just don't waver on that whatsoever. And we do some third-party audits when it relates to just verifying that the herbs themselves are what they say they are. So we take that aspect very, very seriously, and we proudly, from a sustainability standpoint, not to overdo it here, but we do give a portion of our revenue to an awesome charity called Wild Aid. And you can read more about that on our website or at wildaid.org. So just some background from a safety and from the perspective of where does all this stuff come from. I do want to just read one very quick disclaimer as well, that none of what Eric has just said have been evaluated by the FDA. He's a pretty smart guy. He's got a PhD. He knows the stuff backwards and forwards, but this is not intended to treat, diagnose, or cure anything. And we'd invite you, if you've got more questions beyond what's involved with the topic today, to do talk to your primary care practitioner, or reach out to an acupuncturist in your community. If you don't have one or you're a bit intimidated, call us and we'll help you find one. Because this stuff is very, very powerful. So just some boilerplate stuff that I got to put my legal hat on here for a second. But one question, Eric, that came in that's actually quite interesting and specific. We had somebody just type in that they've been trying to get pregnant for the last 6 months, and her doctor put her on a drug called Clomid. Can she take the women's kit as she's taking Clomid?
Good question. You can. So Clomid, I'm familiar with Clomid. Clomid works by promoting ovulation. Not in the way that emotional balance does. It really forces a woman to ovulate. And so again, this is an interesting difference between sort of the drugs of Chinese medicine and the drugs of Western medicine. Emotional balance is going to promote ovulation, but it's not going to kind of force you to do it. I would say you could. I think actually you might just get your best benefit from maybe just using women's formula. One concern, now Clomid does help women ovulate, but it sometimes doesn't always help them get pregnant. Interestingly, and you can track that ovulation with ultrasound and as well as simpler methods, with ovulation predictor kits and things like that. But so you can make a woman ovulate. It doesn't necessarily help with getting pregnant. And so I think in that situation, women's kit could be very useful. I think in particular, women's formula might be a really good bet, because you're really sort of that if you think about that as sort of improving the lining, the uterine lining, and trying to sort of optimize it. And that in turn is going to help with sort of implantation of the fertilized egg. I think that might be your best bet. Using emotional balance to help promote ovulation is a bit going to be a bit mute in that situation. So you've got a Clomid kind of doing it for you. I think you could try to use it together. I'm not quite sure what would happen in that situation. I don't think it would hurt. But I would say my first inclination would be say focus on women's formula. I think that would be helpful, because there are many instances of women who are on Clomid but still don't get pregnant. So that might be a good solution for that.
That's very helpful. Another question is, can you talk just a bit more about how women in China use women's formula? Is it part of just the pregnancy process, or is it something they take on a more regular, standard basis?
That's a great question. So I think there's a whole range of ways that it's used. So there's both the professional ways, and we're getting into that a little bit today. Like doctors of Chinese medicine, like this is sort of a key formula for their practice. There are sort of the more there are sort of on the other end of the spectrum, sort of at that level of kind of like a supplement. Women in China can kind of walk into any pharmacy and pick up this a similar product. They can also kind of take it on their own. And in that situation, they would do it in a similar way to the way we're recommending here, sort of at the beginning of the cycle, trying to help sort of improve. Improve and optimize the cycle overall, but it's not necessarily to get pregnant. It's just it's a sort of an extra step in terms of sort of managing your cycle. If you kind of think back to the beginning of the talk when I said women are being very careful about what they eat, and they may do things like avoid swimming while they're menstruating and things like that. This would be, for women who are like interested in even doing going the next step, or they think they need a little bit more help, they would be ones who are kind of doing this on their own.
Awesome. I asked that question actually because I remember the meeting we participated in I think either Beijing or Taiwan, I can't remember, but that had come up in a prior conversation I had. We've gotten a series of questions that I can actually tackle as it just relates to the product itself. How many packets do you need to take? I'd refer us all back to the earlier recommendations from Eric, and then also check out the website. But it can be anywhere from, Eric, correct me if I'm wrong, depending on the circumstances, 1 to 2 packets a day.
That's right. And so the way we've done the product is, 1 packet right now is basically sort of a single dose or a portion, if you will. And you can, but you can certainly do 2. You can certainly do 2 a day, and that's sort of what we're recommending. I think 3 a day is probably a little bit too much for most women, but if you did 3, that's probably okay. But we recommend sort of 1 to 2 a day. So 2, if you're really kind of you really want to make this problem go away, whatever it is, do 2. If it's say if it's PMS and your symptoms are pretty light, maybe you just need 1 packet a day.
And I would say, as it relates to emotional balance, that we love all of our formulas here. I've been sipping on one the entire discussion, and it's great. I usually have 1 or 2 a day, and so it's not an exclusive product to women. We drink it here a lot, and we feel really great as a consequence of it. So don't forget your husbands, partners, spouses, all that kind of stuff. Just some other odds and ends here. Is it a tea? It is not a tea. These are Chinese herbs. So unlike a tea that you would boil in hot water and it's in a bag, these actually are herbs that we've processed and that we actually package and complete here in the United States, which I think is something that is important as we think about some of the topics or the broader topics at hand. It can be added to cold water, which is pretty cool. Most Chinese herbs, you would have to boil water. If we go back in sort of the purest form, you would go to a Chinese medicine doctor or an acupuncturist, and you get a bag of leaves, and in some cases, it's God knows what the hell they just put in here, and you boil it down and make a concentration, and you add a tremendous amount of honey for reasons we'll talk about here in a second. These are powders that we've taken all those herbs, we've converted them to powders, and then related to a next question that we've gotten about 3 of right now, how do these taste? Well, I'm so glad you asked. There's a reason that we put honey, or the Chinese medicine doctor would say put a lot of honey in the products, or the herbs, I should say, because Chinese medicine is never going to win any sort of award for tasting great. Just the opposite. There's great clips that you can find on YouTube of like Andrew Zimmern drinking this stuff and losing it over the Kowloon Bay. It tastes terrible. What we've done at DAO Labs, though, going back to what I said at the top, is we've tried to make this stuff approachable and easy. And so we've aligned the herbs themselves with flavors that we think, that Eric would tell you, aligns with the efficacy of what the product is supposed to do. So as it relates to women's formula, we've paired it with an awesome raspberry black pepper combination. And then as well with emotional balance, we've done an apple and cucumber. And for reasons that are beyond what I understand, those just align from an efficacy and a sort of a Chinese food as medicine standpoint, but they also, we think, taste pretty good too. So that's the kind of answers to the logistics of this stuff, but they are meant to be taken with cold or room temperature water. So just pour it into your water bottle and go. There's one question that came in that I'll read it, and Eric, if you could clarify.
Sure.
I'm going to read it verbatim here. For the women's kit, if I understand correctly, for regular maintenance, the women's formula should be taken the first day at the end of the period, and the emotional balance taken a week prior to when the period starts. For fertility and irregular periods, the women's formula should be taken the first day of the period, and that's the question.
Say the last part of that question again, for the first day of the period.
Sure. I think she's asking for fertility and irregular periods. The women's formula should be taken the first day of the period. So why don't you just kind of walk through both
okay,
those,
sure.
for regular
Yeah.
maintenance and then for fertility. And we'll actually have everybody capture this as well in our notes, and we'll make it pretty easy to understand.
Yeah, that's a great point. I think for everyday use, we don't recommend that you take women's formula during the period. Now, a Chinese medicine doctor may use it that way, and that's could be a little bit more complicated situation. Interestingly, it's sometimes not recommended to be used during the period. No, so it's not impossible to use it during the period. You can do it. You might do it for some cramping or something like that, but wouldn't really recommend that for fertility. So fertility is what you're interested in. We usually recommend to waiting until after the period is over. The reason we recommend not doing it during the period is it can cause a little bit of extra bleeding, just because it has a bit of blood activating herbs in it. But there are situations where you want that during your period. But for the fertility and for our more general use, we recommend sort of waiting until your period is over. Sometimes give it a day. Maybe give it one more day just to make sure it's truly over. There are women who will report that if they sort of maybe wait till the last day of the period and then start something like women's formula, that the bleeding picks up a little bit. If you don't want that inconvenience, then we recommend give it sort of 1 day, maybe even 2 days that the bleeding is totally done. Then start women's formula. And then follow it pretty quickly after that with emotional balance. So that's sort of the fertility. That's the little fertility formula. Now, this, by the way, let me just add a few words here too. There are many causes of infertility out there. Infertility is a very complicated problem. If you've got something like endometriosis or polycystic ovarian syndrome, you know that. And this combination is not necessarily going to resolve some of those most complicated problems of infertility. However, it can help. And there are so many women out there who have none of those things, and doctors just can't find a reason why they're not getting pregnant. And maybe it's a little bit of maybe it's age related. Maybe it's not. There's reasons we could surmise kind of through a good Chinese medicine diagnosis. But those are the situations where sort of nothing's really coming up in Western medicine, where the women's kit is going to be this really powerful solution to the fertility question. And does that answer that question?
I think it does.
Yeah.
And I, again, invite people to go to mydaolabs.com, where we've got some of those broken down. If you go to the homepage about midway down, you'll see the Own Your Cycle campaign. And what we'll be doing is updating the content there just to kind of break down the two sort of applications that you ask about, and then provide the specifics.
Yeah.
We've got somebody that's asked a question about if these products can be taken, specifically digestive formula or digestive harmony. Eric, can she use Digestive Harmony as the same time she's using women's formula, or should we stop while consuming the women's kit?
Okay. So this is referring to our another one of our products, Digestive Harmony.
Yeah.
And can that be used together with women's kit or women's formula? Is that
Basically,
the question?
can she take them simultaneously?
Yes. Actually, that's a very good question, and you can. The Digestive Harmony formula is a very gentle formula to really improve digestion. Digestion can be a big factor in dealing with all kinds of gynecological issues. And if you remember, when we talked about emotional balance, there are a couple herbs in there that are helping to deal with what's called spleen T deficiency. Spleen T deficiency is manifested by sort of a lack of appetite and a little bit of fatigue. Those are all kind of considered digestive issues in Chinese medicine. So even in emotional balance, there's already a recognition that we often need to deal with digestion in a number of gynecological sort of situations. Digestive Harmony is actually a formula that does combine very nicely, really, particularly with Wyndham's formula, but also, I would say you don't need it. You don't necessarily need it with emotional balance because you're already kind of getting some of that. It wouldn't hurt, but I think combining it with women's formula is actually an excellent idea. And in particular, if digestion is sort of something you really struggle with, this is also sort of, part of the idea. If that idea of regulating and balancing is kind of the key to gynecology, well, getting digestion back in balance too is also going to be really important for all kinds of, whether it's fertility or other gynecological issues.
That's awesome. We need to start wrapping it up. There are a handful more questions that we'll answer electronically. So thank you all for submitting those. We're not ignoring them, but in the interest of time, we're going to wrap it up here. I want to, first of all, thank everybody for participating this afternoon. This will be recorded and most certainly we'll socialize it. And it's also going to be streaming probably again on Facebook. For more answers, for questions, things of that nature, I certainly invite you to reach out to us. Tracy Dwight's my colleague, and she made all of this happen today, which wasn't necessarily the easiest task, but we're here to answer your questions, and we want to help. So if there's things that kind of you think about in the middle of the night as a consequence of listening to this, email Tracy at mydowlabs.com, TRACEY at mydowlabs.com. Please feel free, if you are interested in trying the product, again, use discount code CYCLE10, and you'll save 10% off the two-month box. And with that, we're going to let the rest of you go on with your Tuesday afternoon. Thank you so much for participating, and stay tuned. We'll be hosting another webinar in about 4 weeks' time, and we'll let you all know about that. So that's it.
Thanks everyone.
Thanks, Eric.
This was fun. I hope this helps.
Sounds great.
Yeah.
Thanks, everybody. Hold on one second.
Okay.
Hold on, let's just make sure we're off.
Do we ever go to straight video of me or you, John?
No.
I think we did.
I don't know if we.
Well, maybe we did.
1 second. Let me just make sure we're off.
Okay. Oh, still live from Stephanie.